I think it's about time we had a talk about this little bugger right here. It's been causing us trouble for 3.5 years now. And to be fair, a lot of the trouble was actually caused by humans. Let's get into that. Hello and welcome again to The Simple Skeptic. Please hit the subscribe button if you haven't done so already. Hit that little bell, you'll be notified every time a new video comes out, and hit the thumbs up or thumbs down. Really doesn't matter to me. If you want to engage, there is the option down below. COVID-19. Hard to believe that such a tiny little thing can cause so much strife. But it did. And as I said before, a lot of it was our problem. It was the fact that we didn't react to it properly. Let's talk about viruses themselves. They're not living, as far as we can determine, but they do contain elements of life such as DNA or RNA. And once they get into the cells, their tactic is to program your cells to produce more of them. They cannot produce on their own. They hijack your cells and have them do it for them. That is basically the way viruses work. Now, what problem do we have fighting these viruses? Well, first of all, we have to come up with effective vaccines. That takes time. Second, and this is the part that really galls me, we have to fight off people who think that vaccines don't work. And it's easy to understand how they do work. These people have been brainwashed by Luddites, people who are just against everything modern. Although they get on the internet, on their computers or on their cell phones and blab about how evil modern technology is. Vaccines are very simple. Using a dead or weakened version of the virus, they prepare your immune system to fight off the infection if it gets in. If it gets in. Now, some people think that the vaccination is going to prevent the virus from affecting you. No, it will not. It cannot do that. Anybody who tells you that the vaccination will prevent the virus getting into your body is probably simplifying things. Okay? It can and will get in. The vaccine cannot prevent it. What it does, and all it's intended to do, is prepare your immune system so that it's better able to fight it off. It does not put a force field around your body that prevents the virus getting in. It has just as much chance of getting in as if you hadn't been vaccinated. So why do we get vaccinations? Well, as I said, it prepares your immune system so that you can fight it off a lot easier. That means that your symptoms are lessened. Things like coughing and sneezing are lessened, which means that less chance of passing it on through droplets. Because the symptoms are lessened and because it's fought off faster by your prepared immune system, it means that it's in your body for a shorter amount of time. So those symptoms like coughing and sneezing have even less time to spread it. And even though most people are going to be able to fight off most infections fairly easily, even without a vaccine, the elderly, the extremely young, those with compromised immune systems, they are in danger. But the anti-vaccination types don't seem to care about those people. Why are some people anti-vaccination? Well, we've had them around for a long time. We've had people 60, 70 years ago complaining about fluoridation in water.
Do you realize that fluoridation is the most monstrously conceived and dangerous communist plot we have ever had to face?
Which is another non-issue. It's perfectly safe. But those people are still around. And they've also latched onto the anti-vaccine movement. The main villain in a lot of this is this guy here, Andrew Wakefield, a disgraced doctor who years ago managed to get a study published in The Lancet, a respected medical journal, that claimed to show that vaccinations cause autism. Other researchers looked at his work, tried to replicate it, and found out it was bogus. Coincidentally, he was also trying to sell his own vaccine. That sounds a little fishy to me, should sound a little fishy to you. In any event, he was disgraced. He's no longer a doctor. He's not allowed to practice. In my opinion, he should be facing charges at The Hague of crimes against humanity. But that's a job for somebody else. People still use him as a reference when they talk about vaccines and autism. There is no connection at all between vaccines and autism. It is strictly coincidental. Vaccines are given to babies around the same time that autism usually shows up, even before vaccines were used on children. Vaccination has nothing to do with it. Which takes us on a little sidetrack. Why are autism rates skyrocketing? Well, they're not. There's been no increase in autism whatsoever. Let's stop calling it autism for a moment and call it childhood cognitive impairments. The number of children presenting with cognitive impairments hasn't risen one bit. So why are autism numbers apparently going up? It's not really happening. Children that presented with conditions given other names, or conditions that simply had people thinking they were slow, little developmentally delayed, it's now being realized that they have autism. Various other problems that had previous other names are now being moved into the autism spectrum. Let's give you an example. We'll use me. Let's say you have 10 children out of 1,000 present with autism. And you have 10 children out of 1,000 present with Bailey's syndrome. Someone does some research and finds out that Bailey's syndrome is actually a form of autism. So now, children with Bailey's syndrome are moved into the autism spectrum. It seems as if autism has doubled. It hasn't. Bailey's syndrome has disappeared, in effect. You still have the same number of children, 20 out of 1,000. Now, how accurate are those figures? I've just pulled them out of my head. It doesn't really matter. It's just to illustrate the point. Vaccines do not cause autism. Now, another thing you'll quite often hear from the screamers is that vaccines contain mercury. Well, yes and no. Some vaccines contain a chemical called thimerosal, which is used as a preservative. Thimerosal does contain mercury. There it is there with the red arrow pointing at it. You remember from high school chemistry, mercury is Hg. But thimerosal is a stable chemical. When it gets into your body with the vaccine, the mercury does not leave the thimerosal molecule and bind to your body. It's excreted as a complete molecule. It has no effect on you at all. Pure mercury? Yeah, you don't want that in your system. But thimerosal is not a problem. What about the other problems with COVID-19? The measures we took included masking, sanitizing, social distancing. I've heard people say that masking is dangerous because you can't get oxygen into your body. But the COVID-19 virus does get through. There's a couple of problems with that. If oxygen can't get through, how did doctors manage to breathe through a long heart operation? They wear masks all the time. They breathe fine. The other problem is that the COVID-19 virus is thousands of times larger than molecular oxygen, O2, the type of oxygen that we breathe. How is it possible for a mask to stop oxygen, but not stop something that is thousands of times wider? It just doesn't make any sense. Some people act as if their rights are being taken away by being asked to wear a mask. What right do you have to infect other people when you can take a very simple measure to reduce the impact of a virus that can kill What right do you have to fight a simple thing like a mask and spread it around? Sorry, there are times when you just have to suck it up and do what's good for society. And if you don't believe in doing that, I have very little respect for you as a person. Your humanity is gone. But some people say that these measures don't even work. Really? Let's take a look at the figures. Before COVID-19 hit Canada, we were averaging over 43,000 cases of reported seasonal flu per year. 43,000. When COVID hit, we started masking. We started sanitizing. We started social distancing. In the next flu season, 2020, 2021, with twice as much testing, how many cases of seasonal flu were reported in Canada? 66. We went from 43,000 to 66. The only thing that can account for a drop like that is the measures we took against COVID. Because masking, sanitizing, and social distancing will also work against other viruses. The vaccines have to be specific. A vaccine for the seasonal flu is not going to work against COVID because they're different viruses. But the measures to prevent transmission definitely worked. When you go from 43,000 to 66, only an idiot could say otherwise. Let's take a look at some of the reports that back that up from the press. Wednesday, March 31st, 2021. This is from the Canadian Press, as reported in the Toronto Star. The flu season that never was. COVID-19 pandemic keeps other viruses at bay. The 2021 flu season will go down in history as the epidemic that never was. By this time of year, Canada has normally logged an average of more than 43,000 confirmed cases of influenza. But this year, the Public Health Agency of Canada says there was a total of just 66 confirmed cases as of March 20th. There's been no evidence of flu spreading in the community, no confirmed outbreaks, and the number of hospitalizations and deaths due to flu is 0. By the same week last year, there have been 40,101 confirmed flu cases, 2,232 hospitalizations, including 273 patients admitted to intensive care, and 97 flu-related deaths. That despite testing for flu almost twice as much as usual. Between March 7th and March 20th, only 2 tests were positive in more than 42,000 done. In the same period over the last 6 years, about 22,000 tests were run and more than 1/5 of those came back positive. Dr. Gerald Evans, chair of the Infectious Diseases Division at Queen's University Medical School. I recall some flu seasons that were minimal. You didn't really see a huge jump and in fact some flat rates, but something like this, which is literally the absence of any major identifiable cases in any of the many places across Canada, I haven't seen that ever. He said the reasons for the lack of flu season are varied, but almost all of it has to do with the measures we adopted to slow COVID-19. Greenville Business Magazine, Greenville, South Carolina, the flu season that wasn't. Thousands of South Carolinians get the flu each year. Many winding up in hospital beds and others succumbing to the virus. 2020-21 flu season stands out as almost non-existent by comparison. 5-season average for flu in South Carolina is 3,564 cases, including 6,715 cases in the 2019-2020 season alone. That compares with 116 cases of flu in the 2020-2021 season by the end of April. There were 154 hospitalizations and 18 deaths from flu during that time, compared to the 5-season average of 2,680 hospitalizations and 122 deaths. Up to this point, we've had 113 confirmed cases. Last year, we had over 6,700. Can anyone seriously tell me that the measures we took against COVID-19 didn't work? Flu has disappeared for more than a year. Scientific American. Mask wearing, social distancing, and other steps to stop COVID-19 have also curtailed influenza. As Scientific American reported in November 2020, the drop-off in flu numbers following COVID's arrival was swift and global. Since then, cases have stayed remarkably low. There's just no flu circulating, says Greg Poland, who studied the disease at the Mayo Clinic for decades. The U.S. saw about 700 deaths from influenza during the 2020-21 season. In comparison, the Centers for Disease Control and Prevention estimates there were approximately 22,000 U.S. deaths in the prior season and 34,000 deaths 2 seasons ago. How can anyone possibly deny this evidence? Folks, this is not hard to understand. Vaccines work. Social distancing, sanitizing, masking works. If you explain this simply and clearly, a 5-year-old can understand it. Unfortunately, there's 55-year-olds out there who refuse to understand it. Willful ignorance is killing people. Pride is killing people. A sense of entitlement that they don't have to walk around wearing a mask is killing people. There's no excuse for it. And with a new variant of COVID coming out now, as I'm doing this, it's going to happen all over again. Maybe not as bad as it was when it first came in, because a lot of people are realizing that they have to take measures. But people will continue to get it, and people will continue to die because of the selfishness and willful ignorance of others.